Most men over 60 won't admit this. But I will. Because what I'm about to say could save you from embarrassing hospital visits, painful prostate problems, or even a medical emergency. Here's the truth. Many seniors think masturbation is something you're supposed to outgrow. Others keep doing it in secret, but without realizing they're putting their body under unnecessary stress. The worst part. Most men only realize they've been doing it wrong when it's already too late, when they feel pain, swelling, or spot blood where it should never be. As a urologist, I've seen it all. Men in their 60s, 70s, even 80s coming in scared, ashamed, and asking the same question. Doc, is it even safe for me to still do this? And the answer is, yes, it can be safe, if you know the right way. But there are also hidden red flags that every man needs to recognize before it's too late. So today, I'll explain how to masturbate safely after 60, when it's actually good for you, and the warning signs that mean you should stop immediately and call a doctor. And let's not waste time. I'll start by giving you the third safest habit right now, because it's the one most men ignore. Never do it on an empty tank. I'll explain what that means, and why it could protect your prostate, in just a moment. Before we dive deeper, let's be brutally honest about the problem. Most men over 60 aren't talking about this. Not with their doctor, not with their spouse, not even with their closest friends. There's this silent belief that masturbation is shameful at an older age. And because of that silence, dangerous mistakes get repeated over and over. The problem is, your body at 60 isn't the same as it was at 20 or 30. Hormones shift. Circulation slows down. Tissues thin out. The prostate becomes more vulnerable to irritation. Yet many men keep treating their body the same way. Fast, rough, ignoring discomfort, without realizing the strain it causes. And let's not forget the emotional side. Men often mistake discomfort as just age, or worse, they hide it out of embarrassment. That delay in seeking help is exactly what turns small issues into chronic pain or even serious disease. So the clear problem is this. Seniors don't have the right information. They either avoid the subject completely, or they keep doing things that put their health at risk. Today, we're breaking that silence and giving you the blueprint for safety. Now let's bust the biggest myth. Masturbation weakens men. I hear this all the time. Some men over 60 come into my clinic worried that continuing the habit is making them weaker, lowering testosterone, or causing prostate cancer. Others think it's something shameful that should have been left behind with their youth. But here's the truth. Masturbation, when done safely, does not make you weak. In fact, research shows it can support circulation, relieve stress, improve sleep, and even lower the risk of certain prostate problems by keeping the gland active. The real problem isn't the act itself, it's how you do it. When men are dehydrated, rushed, or ignoring pain signals, that's when trouble begins. That's when the prostate gets inflamed, the bladder starts spasming, or infections creep in. So let's be clear. Masturbation isn't the enemy. The myths surrounding it are. And by the end of this video, you'll know the safe way to continue without putting your body at risk. Here's something most men never think about. Your prostate is a gland, not a muscle. And just like any part of your body that produces fluid, it works best when it's supported. That means hydration. When you're younger, you might get away with skipping water all day and still feeling fine afterward. But past 60, your body doesn't bounce back the same way. If you're dehydrated, your prostate fluid becomes thicker, harder to push out, and this puts more strain on your pelvic floor. It's like trying to flush mud through a narrow pipe. Eventually, that pipe gets irritated, swollen, and painful. This is why so many older men complain about a heaviness or dull ache in the groin after releasing. Most of the time, it's not a disease. It's poor hydration and a stressed-out prostate. I tell my patients, think of water as the oil for your body's engine. If you run the engine dry, parts wear down faster. But if you keep it well lubricated, it runs smoothly, even in old age. So here's the simple fix. Before you even think about self-pleasure, drink a glass or two of water. Give your body the fuel it needs. Not coffee, not beer, just clean water. Within weeks, many men notice less pressure, less discomfort, and healthier urinary flow. And here's the kicker. Hydration doesn't just protect your prostate. It also protects your bladder. An underhydrated bladder is more prone to spasms. And that's one of the main reasons older men end up rushing to the bathroom at night. So by drinking before, you're actually improving two systems at once. Now, this habit sounds simple, almost too simple, but it's one of the first things I notice when men come in with prostate complaints. I'll ask them, how much water do you drink a day? Most say, not enough. And their symptoms match. So remember this. Masturbation itself isn't the enemy. Dehydration is. And by staying hydrated, you give your body a fighting chance to keep functioning well into your 70s and beyond. But of course, hydration is only one piece of the puzzle. There's another safe habit. One that's even more important. Because even if you drink enough water, if you ignore the warning signals your body sends during the act, you could be walking straight into danger. And that's what I'll break down next. If there's one mistake I see too often in men over 60, it's this. They try to perform the way they did at 20. Fast, rough, ignoring discomfort, pushing their body beyond its limits. And let me be blunt, your body after 60 is not the same body you had at 20. The tissues are thinner, circulation is slower, and your prostate is more sensitive. Here's the truth most men don't realize. Pain is not weakness. Pain is a signal. It's your body's way of saying, stop. Something isn't right. Ignoring that message can lead to serious consequences. Swelling, micro-tears, or in the worst cases, infections that land you in the ER. I've had patients come in embarrassed, whispering, "Doc, I thought it was just soreness, but then it got worse." And when I examine them, I find irritated tissue or inflammation that could have been avoided if they had simply listened to their body's warning signs. So what does listening actually mean? If you feel sharp pain, stop immediately. Sharp pain is never normal. If you feel burning after, don't ignore it. That could signal irritation or even an infection starting. If you notice swelling, don't push through. Give it time to heal, just like you would with any other injury. And pacing is just as important as listening. Think of it like exercise. You wouldn't sprint a marathon, right? You'd pace yourself, warm up, and cool down. Self-pleasure works the same way. When you're younger, you might rush through. But over 60, rushing can shock your system. Here's what pacing looks like in practice. Slow down your rhythm. Give your body time to adjust. Take breaks. A pause is not failure. It's protection. Focus on relaxation, not just release. This reduces tension in the pelvic floor and supports healthier circulation. Men who pace themselves often notice something surprising. Their experience actually improves. It's not just safer, it's more satisfying. Because they're not fighting against discomfort, they're working with their body. Now, let's add one more layer. Pay attention to what happens afterward. Do you feel light and relaxed? Or do you feel drained, sore, or restless? That after effect tells you a lot. If you constantly feel worse after, that's your cue to adjust your pace or check in with a doctor. This habit is so critical because many older men try to tough it out. They think ignoring pain makes them stronger. But ignoring pain doesn't make you strong. It makes you vulnerable. The men who last longest, with the healthiest prostate and the fewest complications, are the ones who listen and adapt. So remember this rule. When your body whispers, pay attention. Because if you don't, one day it will shout, and by then, the damage may already be done. But hydration and pacing are just the start. The most important safe habit is still ahead, the one that separates a normal experience from a medical emergency. And if you miss this one, no amount of water or pacing will save you. I'll reveal it next. We've talked about hydration. We've talked about pacing. But the most important safe habit, the one that truly protects men over 60, is this: knowing when to stop. And here's why. Most older men don't recognize the difference between normal sensations and dangerous warning signs. They brush things off, telling themselves it's just age, or just soreness. But I've seen men ignore small red flags that later turned into something far more serious. So let's break down the 3 biggest red flags you must never ignore. 1. Blood in your semen or urine. This is the most obvious red flag, yet many men try to downplay it. Maybe it's just a burst vessel. Maybe it'll go away. Sometimes, yes, it's harmless. But it can also signal prostatitis, a urinary tract infection, or even the early stages of prostate cancer. If you ever see blood, whether it's pink, red, or brownish, stop immediately and call your doctor. Don't wait to see if it happens again. Don't keep going. Take it seriously. 2. Persistent pain in the groin or lower back. Occasional mild soreness might not be alarming. But if you feel deep, lingering pain, especially in the perineum, the area between the scrotum and anus, or in your lower back, that's a red flag. It could mean inflammation of the prostate, nerve irritation, or even a hernia being aggravated. This is your body waving a red flag saying, pay attention before this worsens. 3. Sudden changes in function. If one day you notice it's suddenly harder to reach climax, or you're struggling with weak flow, or you feel numbness where there used to be sensitivity, those aren't just signs of getting older. They can indicate circulation problems, nerve compression, or hormonal imbalances. And in men over 60, ignoring those signs could mean missing an opportunity for early treatment. Now here's the part most men don't realize. The act itself isn't dangerous. The danger is in ignoring what your body is telling you. Just like chest pain during exercise can be an early warning for heart trouble, discomfort during or after masturbation can be your early warning for prostate trouble. And let me give you a story from my clinic. A 67-year-old man came in embarrassed, whispering about spotting blood after release. He thought it was nothing, but his wife pushed him to see me. We ran tests and caught an early prostate tumor that was still treatable. If he had ignored that signal, we might have found it too late. That's why this habit matters. So here's how you practice safe habit number 1. Check afterward. Pay attention to how you feel in the hours and days following. Don't normalize new pain. If something feels different, don't write it off. Seek help early. Doctors would rather you come in for something minor than wait until it becomes major. And I'll add this, if you have any condition like diabetes, heart disease, or are on medications that thin your blood, these red flags are even more important for you. Your body is already under extra stress, so ignoring signals is riskier. So here's the bottom line. Masturbation after 60 can absolutely be safe. In fact, when done properly, it can support circulation, reduce stress, and even lower the risk of certain prostate issues. But safety doesn't come from pretending nothing can go wrong. It comes from recognizing when something is wrong and acting on it immediately. Hydration protects you. Pacing supports you. But it's safe habit number 1, the awareness of red flags, that saves you. Because no pleasure is worth gambling with your health. And in just a moment, I'll share the single biggest mistake men over 60 make. One that undoes all these good habits and puts them right back at risk. You'll want to avoid it at all costs. Now we've covered the 3 safe habits that protect you: hydration, pacing, and recognizing red flags. But there's one mistake that wipes all of that away, and I see it far too often in men over 60. That mistake is ignoring recovery time. Here's what happens. A man feels good, so he thinks, why not do it again tomorrow? Or even later the same day. In his 20s, his body bounced back quickly. But at 60, 70, or beyond, the prostate doesn't recover overnight. It needs time to clear out inflammation, restore circulation, and rebalance hormone activity. When you don't give it that time, you're forcing your body to work in a constant state of irritation. That's when pain lingers, swelling builds, and minor discomfort snowballs into chronic prostatitis. It's like working a muscle without ever letting it heal. You don't get stronger, you just get injured. I tell my patients, frequency matters as much as technique. A healthy rhythm for most men over 60 is once or twice a week, not every day. And if you feel sore, wait longer. Your body will thank you. So don't sabotage your progress by rushing back in. Respect your recovery time. Because if you don't, every other safe habit becomes meaningless. And now, let's put it all together. I'll show you the simple daily routine that keeps your prostate safe, your energy balanced, and your confidence intact, even after 60. So, how do you make all of this simple, something you can actually follow without overthinking? Let me give you a safe routine I recommend to my patients. Start with hydration. Every morning, drink at least 1 full glass of water before coffee or tea. This sets your prostate and bladder up for the day. If you know you're planning intimacy or self-pleasure, add another glass an hour before. It's the easiest way to protect your system. Next, practice pacing. Think of it as exercise for your pelvic health. Don't rush, don't push through pain, and if you notice discomfort, stop. If it feels right, take breaks. It's about quality, not speed. Third, respect recovery. This is the habit most men overlook. Your body needs time to reset. Once or twice a week is healthy for most men over 60. If you're dealing with any chronic conditions or medications, be even more conservative. Remember, recovery time isn't weakness, it's wisdom. Finally, check the red flags. Afterward, pay attention to how you feel. No blood, no lingering pain, no drastic changes? Good. But if something seems off, don't ignore it. Write it down, track it, and if it repeats, call your doctor. That's it. Simple, steady, safe. With this daily rhythm, you're not just protecting your prostate. You're giving yourself confidence, energy, and peace of mind every single day. And now, before we wrap up, let me leave you with one more thought that could save you from unnecessary risk. If you've made it this far, that already tells me one thing. You actually care about your health. And that matters. Because most men your age would rather stay silent, pretend nothing's wrong, and then face painful surprises later. But you're different. You've taken the time to learn, and that means you're already ahead. Now here's what I want you to do. Hit subscribe and turn on notifications. Because every week, I break down men's health topics that most doctors won't talk about openly, especially for men over 60. And trust me, you don't want to miss what's coming. In my next video, I'm exposing one everyday bathroom habit that silently damages your prostate, and almost every man over 60 does it without realizing. If you thought today's video was eye-opening, wait until you hear this. And before you go, leave me a comment. Which of the 3 safe habits surprised you most? Hydration, pacing, or the red flags? I'll be reading through them personally. Stay safe, stay aware, and I'll see you in the next one.